All right, so what's the difference between a medical doctor and a chiropractor? Think of medical doctors as medical generalists. They are able to treat a whole bunch of stuff and diagnose literally anything from pediatric stuff, from babies that have coughs to people that have cancer. They treat the entire lifespan of people and everything and anything that comes through their office. The U.S. medical system has moved into like referring to specialties as necessary, but that's a whole other tangent. Think of chiropractors as specialists, as musculoskeletal specialists. We have the same basic training. We have a bachelor's degree, usually in some science thing or something, bachelor's degree plus prereqs to get us into a chiropractic program that are science pre-med, as do medical doctors. Then the first 2 years of both programs are exactly the same as far as subject matter. Chiropractors get more in certain areas, and I can list those, but most of them are like orthopedics and anatomy and physiology, differential diagnosis, which is interesting that we get a really pretty heavy training in that, and a few other things, and microbiology and neurology. So things that are pretty much within our musculoskeletal systems. Medical doctors continue being generalists through the remaining 4 years, or the remaining 2 years. And after the second year, we start specializing on hands-on orthopedics, musculoskeletal, treating bone and muscle and neurological pain. Think of chiropractors as like your dentist or your physical therapist or your occupational therapist, your whatever person that is a doctor of. We are a doctor of chiropractic, but chiropractic could also just say of musculoskeletal conditions. We do have different scopes depending on what state we're in. Oregon has a really, really broad scope for chiropractors. They can do everything from, they can catch babies, they can do minor surgery, they can do proctology, they do nutritional stuff, lifestyle modification, which those are usual chiropractic stuff. In Ohio, I can only order labs and run functional labs on, nutritional labs on people, refer for MRIs, physical therapy, etc., like that, x-rays, things that are clearly within my scope. So again, medical doctors tend to be generalists, chiropractors are specialists. If you want to look up why we are the redheaded stepchild, look up the Flexner report.